My name is Dr Ghassan Abu-Sittah. I'm a British Palestinian plastic and reconstructive surgeon. So I arrived in Gaza on the morning of the 9th of October 2023 and went to work at Shifa Hospital. I remained at Shifa Hospital until the morning of the 17th of October when I moved to Al-Ahli. And I was in Al-Ahli Hospital on the 17th of October when a missile was fired at Al-Ahli Hospital, killing 483 Palestinian civilians. And then I returned to Shifa Hospital and then spent the rest of the 43 days between Shifa Hospital and Al-Ahli treating the wounded from the war. So from the very beginning it was obvious that almost half of the wounded were children with very severe injuries, debilitating amputations, very severe facial injuries, a lot of women, elderly men. Mainly, basically, people were being taken from underneath the rubble of their homes after the air raids and then brought to the hospital in the hundreds. The numbers far exceeded what the health system could ever treat. When I went to Gaza, it was in day 2 of the war. It wasn't until the 17th of October and the massacre at Al-Ahli Baptist Hospital that I realized that the targeting of the health system was a central component of the Israeli military strategy. And so the bombing of Al-Ahli Hospital, then the bombings around Shifa Hospital, and then the bombing of Nasser Children's Hospital, bombing of Al-Auda and Indonesian hospitals in the north. And so it kind of unraveled this military strategy where the destruction of the health system was at the heart of the military strategy. So from the beginning, it started to become obvious that health workers were being targeted. So early in October, our colleague Dr Midhat Saydam, who is a plastic surgeon, was killed by the Israelis in his home. And then soon after, Dr Hammam al-Loh, who was a kidney specialist, was killed the same way within minutes of arriving back to his house. And then by the ceasefire, 15 months later, 950 Palestinian health workers, doctors, nurses, lab technicians had been killed by the Israelis, to the point where we now know that the risk of being killed in Gaza, if you're a health professional, was 2.5 times more than any other profession. And so it was obvious that part of the destruction of the health system was the wiping out of a whole generation of health workers. One of the most important things in war is, as a doctor for me, and part of the duty of care, is to speak out on behalf of your patients. And so after the massacre, and when we were able to move the wounded survivors to Shifa, I was asked to be part of the press conference as a survivor and as a witness. We could see bodies of children piled up, both dead, not moving, and wounded. And it was extremely difficult because the shock of being in that massacre, you know, despite the fact that I have had over 20 years of war surgery experience, I'd never been inside a hospital that was bombed in itself. But it was important because I realized at that point that that's the day the war ended and the genocide began. That the destruction of the health system, that intentional targeting of hospitals, aimed at killing more people than the bombs were going to kill by destroying the health system. The number of wounded was so much more than what the system could support or treat. And as the system was being targeted, the capacity of the system was diminished. And so from the very beginning, this process of triage, deciding whom you can help, with the small resources that you have and who you need to leave to die. And so I can't remember who I was speaking to just yesterday or the day before. And I remember on a day, a man in his mid-40s who came to us at Al-Ahli hospital after Shifa had been surrounded, and so Ahli became the only hospital accessible in Gaza. And there was only 2 operating rooms left at Al-Ahli, no CT scan. And he had a shrapnel in his head and an obvious head injury. But we had no CT scan, we had no neurosurgery kit, we had no neurosurgeons. And we left him to die overnight on the trolley of the emergency department because there was nothing that we can do to help him. And there are times when you intervene to help someone to save a life, but because of the lack of medication, especially anesthetic, we were having to operate on the wounded, some of them children, with no anesthetic. Because unless you did that, they would die from the infection. I did amputations on 6 children. One of them was a 3-year-old boy, and he was the sole survivor of his family. So he has no one left. I think that on a popular level, on a people level, it has changed something. I think the number of witnesses, the number of doctors who've been coming out of Gaza talking about this, the scale of the genocide, the fact that in the 21st century this genocide was fully televised has altered the public perception about what's happening in Palestine. Unfortunately, what's not changed is Western governments' blind support of Israel and complicity in many places in the war, through the provision of weapons, through direct military intervention, by targeting and silencing voices that were calling for a ceasefire. So I was then first banned from entering Germany, and then the German government placed a ban for me to enter the whole of the Schengen area. And so when I went to France, I was also deported from France. But at the same time, pro-Israel organizations in the United Kingdom have submitted complaints against me with the General Medical Council to have my medical license removed. So I have 2 cases of complaints by an organization called UK Lawyers for Israel to have my medical license withdrawn from me, so I cannot practice medicine in the UK. Well, the case is still pending and is under investigation. I also, by the same organization, have a case against me with the Charity Commission that regulates charities to have me banned for life from holding any office in a UK registered charity. There were 4 complaints against me made with Glasgow University when I was being elected as the rector of Glasgow University. So the silencing aims at 2 things: silencing the individual, but also at making an example out of this individual so that other people self-censor, so that they don't have to go through the process. So they look at what they've done to you and they say to themselves, I don't want this to happen to me. And so they start censoring themselves. I mean, you look at my feed on X, there's continuous stream of threats to myself, to my family. But at the end of the day, you owe this to the people you left behind, who have no voice, whose voice has been stripped away because Israel has made sure that no foreign journalists go in, because Western governments and Western media has colluded to silence the Palestinians. And so it becomes more important for you to speak out when you're out. It's even more important because what Donald Trump does is he tries to normalize ethnic cleansing by talking about it as if it's a redevelopment project in a beachfront, or he normalizes genocide by talking about annihilating everybody in Gaza. And so what is critical, and what we've been warning from the very beginning of this genocide, is that if this genocide goes unpunished, then the rest of the 21st century will be filled with genocidal wars. The rest of the 21st century, there will be wars conducted where the central doctrine of the war is the destruction and the targeting of the health system. Gaza has always been a laboratory to testing out mechanisms and methods and technologies for dealing with surplus populations, populations that are politically unwanted or socially unwanted or eventually economically unwanted. So I had worked in Gaza in 2009, where the Israelis extensively used phosphorus burns. So I'd seen what they look like, and I knew what they look like. So when they started using them in Gaza, I remember the first patient that I saw was a 13-year-old boy who had burns in his back from phosphorus. And him and his father were escaping their house in the northern part of Gaza when the Israelis were firing phosphorus. And then we started seeing it when the Israelis targeted people escaping El Shati refugee camp in Gaza City. And the thing with phosphorus is, if you've seen it once, it's a very distinctive pattern of burns. The phosphorus pellets, which is a chemical burn, hits the body and burns into the center of the body. And so you see the body full of black marks, and the burn goes all the way inside to the very core of the torso.
It's prohibited.
And that's why it's prohibited. Mm-hmm. I think it brought back very difficult memories, and I've only seen it once, and I've not seen it all at the same time, and I've never seen it with other people. I think a lot of it reminded me of a lot of the not just the experiences that I had in Gaza and the pain and the suffering. It brought back memories of the pain and the suffering that I witnessed, but it also brought back the pain that I had felt when I left, the sense of guilt that I had felt when I left Gaza, towards the people that I left behind, towards the colleagues that I'd left behind. It's not a very easy thing for me to watch, but it's important. It's important from a political point of view. It's important, and one of the things that I've discovered is it's become important document that a lot of people in the health sector watch, because they believe that this is the role of medicine, to be there for people when they need you. Well, absolutely. I mean, we're hoping. So the second stage of the ceasefire, the one that the Israelis are now reneging on, was supposed to allow medical teams to go in through Rafah, through the Egyptian side. And so hopefully because this health system needs to be rebuilt. There's over 100,000 wounded still in Gaza. Many people need repeated surgeries. So the destruction of the health system means that there needs to be a rebuilding. What is happening now with the total siege and the reimposition of siege is the continuation of the genocide, but in a silent form, starving people, denying them health care so that they would die without the Israelis having to bomb them. It's a sense that you owe it to your colleagues, your friends, those who have died, who were killed in the war, those who are still in there. You owe it to the patients, the ones you were able to help and the ones you were never able to help. And I think that's the thing that drives me forward. Thank you.